The programs that were in existence at the time did not know how to handle relapse.
Lisa Baxter has seen what heroin can do to her family, to her community, and to her finances. Lisa's son Michael died of a heroin overdose at her home. He was found dead in the bathtub at the age of 27. He had been in and out of rehab for almost 10 years.
We had our kids in some very, very expensive programs, and people mortgage their houses to get to make sure that their kids will get treatment first and their needs go to the background.
But while it can cost a lot to treat an individual, it can cost everyone around them even more when addicts aren't treated. According to the National Institute on Drug Abuse, America's drug problem is costing the nation $600 billion a year. In California, one study by Columbia University found the burden of drug abuse accounted for nearly 20% of the state's budget. That includes jail time, ER visits, and other medical costs.
I think here in the emergency department, we're at the front lines and sort of the safety net of many of the most complicated public health issues.
Dr. Kevin Jones is with Sutter Health's emergency department. He's also the hospital's resident expert on opiate addiction.
If a patient presents with an overdose, and we are needing to give them naloxone, which is a medication to help reverse the overdose, that patient is going to be here in our department for several hours to observe them, because many times it's not uncommon for those patients to require multiple doses of the reversal agent, and so it does mean that that patient's going to be in our department for several hours.
The federal government is trying to help too. Last year they gave out $1.1 billion in grants through the Health Resources and Services Administration, or HRSA. The cities of Davis, Placerville, and Sacramento all got six-figure HRSA grants to expand their substance abuse services last year. Even then, if you have insurance or even if you don't, it can be expensive.
It's not cheap, yeah. So I mean, even for a low-income population, we're looking at $140, $150 a day for a residential care facility.
Dr. Jonathan Porteous is with WellSpace, a clinic offering inpatient and outpatient addiction treatment. HRSA pays for a lot of what they do, but it's just part of a complex web of funding from multiple sources that allows WellSpace to keep going.
If someone has Medi-Cal and they come into us for medical treatment and they talk about an addiction, we can treat that addiction through their Medi-Cal coverage.
Lisa Baxter and her family spent more than $200,000 on treatment for Michael. Yet when it comes to opiate addiction, she sees an even greater human cost.
It's the number of people who are dying. The number, not just of people, young people, the number of the kids in their 20s, late teens to their early 30s are just, it's horrible.